Alright, so today I'm going to show you guys how to take a Panorex x-ray. So the first thing that you're going to do is search the patient's chart up. So you're going to go into this little file way up there, and you're going to hit open chart. And then what you're going to do is you're going to search that patient's name. Then you're going to double click on it and it should pull up the chart. Once you make it to this page, you're going to hit this little camera button. And then you're going to do single import. And then this is going to be a progress visit for taken today. So I'm going to leave it exactly the same as how it looks. Then you're going to go to image type and you're going to change it to Panorex 1 right here. And then once you've made it this far, you can go ahead and hit scan. And then you'll make sure it's still on pan, and then you'll hit select, and then it'll start to load. Alrighty, so now that we have our camera set up, we are gonna grab our little plastic barrier that's gonna go on the bite stick of the x-ray machine. Looks like this. Then you're gonna come over here, and this is the little stick that it's gonna go on. So all you gotta do is just pop it right on there. And then we can start to get ready to position our patient. So we'll have Tegan come around here. And then if you look at it right now, it's a lot too low for her. So we need to bring it up. And I'll have you step in nice and close for me, Tegan. And then you are going to rest your chin on this clear part. And then you are gonna bite onto this stick. There's a little groove on that stick that I want you to find with your top and bottom teeth. Perfect. And then smile real big for me. Then as you look at her this way, you're gonna make sure her center midline right there is kind of in the center of the stick. Okay, so I'm gonna have you close your lips like you're sucking on a straw. You pull this little piece down, and then I'm just gonna push it against your forehead here. So you just spin this little dial. And then your hands can go right up here on these little handles. And then we're also gonna check the plane angle of her chin here. So if you notice, you can kind of see, she's very straight forward with the ground this way. So that's how you know you're gonna take a very good image with your x-ray machine. If it was aimed up, you would have kind of like a reverse smile. So we wanna make sure she's always nice and straight. Same with every other patient. So now I'll just let our patient know, this is gonna spin around for about 30 seconds. You just hold really still in the same position. And you'll come over to this wall, and you'll wanna make sure your whole entire body is past this wall. And then you're gonna push this x-ray button and hold it until it is all the way done. And you can kind of peek around to view the screen to see when it's done. So now that our x-ray is done, we can let go of this button, and then you'll see that it's all the way back to the final position. So Tegan, you can go ahead and step backwards and watch your head and step out of the machine. And then we are ready to take our second x-ray, which is a Ceph x-ray. Before we move on to our next x-ray, this is what the image looks like on the screen here. Nice pan. So then we're gonna hit import up in this top corner. Super important so that your x-ray will close. And then you'll hit OK. That's how you know it's fully imported. So now that we have done that, we can move on to our Ceph x-ray, which then you can just switch your image type. You don't have to get out of this chart here. You can just switch the image type, and then you're gonna go to lateral Ceph. You're gonna hit that, and it still will upload this pan, but once you take a new image, it will upload the new image right over it. So we're gonna go ahead and hit scan. And then we are gonna hit Ceph this time. And then we're gonna hit select. And then once it has popped up to the screen, we're ready to get our patient in there. Alrighty, so your Ceph x-ray is a little funny. It goes in the patient's ears with these little prongs here. So as you can see right now, it's really, really low for her. So what we're gonna do is we're gonna push our up button, same as we did with the pan machine. And we're gonna raise it all the way up. And you might have to guess a couple times before you get it in the right spot. So what I'm gonna do is kind of guide my patient right in here. And then I'm gonna raise it up just a little bit more. And then we are going to gently, these just move with finger pressure here. So what you're gonna do is keep your patient guided. And I normally warn them that it might tickle a little bit. Once you get it all the way into their ears, you're ready to position this. First thing that you're gonna do though is make sure that their plane angle is on before you push it into the bridge of their nose. So I'm gonna actually have Tegan go down just a touch with her chin, up, a little bit up, right there. And then this stick here. So sometimes this can get a little stuck, so before I even position my patient in there, I'll sometimes make sure this can go back and forth really easily. So now that we know that it's going to, I'm gonna just pull it out a little bit, and then I'm gonna pull this little clear piece down to where the level of her bridge of her nose is. And then all you're gonna do is you're gonna gently push that right into the bridge of their nose. And sometimes you kind of have to line them up a little bit this way. And then all you're gonna instruct your patient to do is bite all the way together on your back teeth, and then stay biting the whole entire time and hold really, really still. This guy's just gonna take about 20 seconds to move back and forth. Alrighty, so now that our patient is in there, they're standing still, it is time to push the X-ray button. And then this one will actually show you when to release the hand switch because it takes a few extra seconds to load, unlike the pan machine. Perfect, so I can let my finger go off the button and then we can go right in and get our patient out of there because it's not the most comfortable thing. And then gently step back and then out that way. Okay, so as you can see, you might have just noticed that the pan was still up on her screen, but now that we have taken a new image, it looks like this. So this is her Ceph X-ray. So we're gonna hit import. And then once we see this, we know that we've got both images saved. And sometimes before I exit out of this screen where we have both images, I'll go back into their chart just to be sure that they saved in there, which they did. So we are good to go. Alrighty, so now that we have both of our images, we're ready to clean our machine. You never ever leave a dirty machine for somebody else to use. Always make sure that you wipe it down as soon as you are finished using it, okay? So you'll come right over here, and that little barrier that we put on, you'll grab with one glove. And then you're gonna take your clean glove with your clean cavity wipe, and you are going to wipe down every surface that the patient could have touched. Sometimes I'll even take the stick all the way out, wipe it with my clean hands, and then I'll get where their hands were on both sides. And then right where it was touching their forehead as well. And what you can do is you can dispose of the little barrier, and then we can use the same wipe. We can come over here. Make sure to wipe the earpieces off really, really well. Sometimes they can leave behind some things for us that we don't want to leave for somebody else. And then I just put that right up there just so it's nice and set back up for the next person.